So we've always believed that mental health related issues is pervasive. It's everywhere, and everybody is burdened by it. Everybody lives with it, and if it isn't, WHO says 1 in 4. We say it's 4 out of 4 because if it isn't you, it's somebody you love, somebody in the family, community, workplace. But everybody is living, or in this case, in the classroom. But everybody is living with mental health related issues. But it's really hard to address them in a meaningful way, where in a transparent, quantifiable, impactful way. And but as a coalition, I feel we can do that, and we can do it in a way uniquely other people couldn't and haven't. And and I do believe that typically, people go down the path of legislation, but I don't know that legislation does it. I think you have to basically, where you can have the greatest impact, arguably, is on the balance sheet and engagement, because it's all about engagement. So if you can speak to the users and you can influence their influence and you can influence their engagement, that is profound. And more importantly, over 95% of the revenue for these platforms comes through advertisers. And you can have transparent clarity on practices. It has to be in plain sight. And that's what we realized we could do if we had an organized approach to building standards and ultimately a system and a rating system where we could hold tech accountable.